Yeah, so luspatercept is a protein. It's a fusion protein that targets the ligands of the transforming growth factor beta pathway. Those ligands have been shown in patients with lower risk MDS to drive ineffective erythropoesis, leading to anemia in patients with lower risk MDS. And indeed, the use of luspatercept has been shown in phase 2 data in the PACE trial to improve the rate of transfusion independence. And subsequently, in the MEDALIST trial, which was a randomized study of luspatercept against placebo after ESA failure, to lead to transfusion independence in almost 40% compared to 15% of patients. After that, luspatercept was moved to the frontline setting in the COMMANDS trial, which tested patients who received luspatercept against ESA as a frontline treatment in patients with lower risk MDS who were transfusion dependent, who had anemia. And this trial was positive. It was reported last year, earlier this year, and the paper was just published in the Lancet. In this ASH, we report updates from the COMMANDS trial, which shows the final analysis, as well as an update from the MEDALIST trial, the first trial that led to the approval of luspatercept, where we confirmed the rates of the transfusion independence and that patients achieve durable transfusion independence with the drug. I also like to point out that we have a trial that just started, another large phase 3 trial with the drug called the ELEMENT, which will look at patients who are not yet transfusion dependent. So those are patients who have symptomatic anemia, similar to the COMMANDS trial, but they are not yet needing transfusions, and the similar randomization to luspatercept versus EPO. And I think this could be a major change in the landscape of management of lower risk MDS, because historically we have not treated patients with lower risk MDS who are not yet transfusion dependent. So if that trial is positive, I think it could be a major change in the way we think about management of those patients.